If you're working in a hospital or any other health environment, it's very easy for that to become routine and ordinary for you, and for patients it's never ordinary. So I think that there's a kind of fundamental, what I think of as an existential problem, which is how do you help staff to put themselves in the patient's shoes? And that is always going to be there under every circumstance, in every system, because it's the difference between being in a place as a member of staff that's your place and where you know everything that works and how it works and who's there, and the patient who's always new and who's full of anxiety. And so I think that this kind of work, patient and family-centred care work, is important because it helps staff to put themselves in the patient's shoes.
It really does look at the whole patient pathway, as well as thinking about things from the patient's perspective, and that's where you get a real fundamental difference and sort of putting right the things that you always knew were wrong with the service. That it's actually thinking about how it feels to be a patient here, and of course the things just, it seems obvious to put things right, whether that's about something really kind of basic around the way that we organise things or the way that we actually interact with people and give them information.
From the team's perspective, what it allowed us to do very much was to think about how we interact with patients, to think about the care experience from a patient's perspective, and to truly understand for dementia patients how it feels to be moving through an integrated care pathway. So for me, that was one of the key benefits that we identified from working in the project. It's really helped to raise the profile of the dementia care experience within the organisation, and it's also helped to raise the profile of patient experience within the organisation. And I think that has been immeasurable in some respects and a massive part of being in the programme. The second key benefit for me has been about enabling the team, the wider team that we've pulled together, to think about the patient experience and to develop services in a way that's allowed them to have some free thinking and to be able to improve the care pathway and improve communication between the teams.
The most important difference is that staff of all levels understand that they can make a difference. And the most important part of that is the understanding that they can and should see things through the patient's eyes. And once they've done that and they picture themselves as patients, things change.
I've always felt passionate about improving the care of service that I deliver to my patients. And this is something that's integral to me and core to my values. And what the PFCC offered me was a conduit, a way of actually channeling that interest, that energy and enthusiasm into a process, a proven methodology. The benefits go beyond individuals. So as a clinician, I feel satisfaction in delivering better care for my patients. So that's integral to why I've done this. Better service for the patients. But actually, if you scale that up, if that same approach, that same attitude is translated or magnified across departments, across directorates, across organisations, that could potentially be a transformative way of actually delivering care. If every care team looks at this care experience or their care experiences through the eyes of patients, it's that the values of the patient, or our values, can be more clearly transcribed or translated into what can be seen for those patients. And an organisation that has the insight and the readiness to do two things, actually. Firstly, to accept that there may be challenges, that there may be unexpectedly poor findings that they will, when they do those shadowing experiences, but also have the readiness to empower the staff to try to change it. And there's a risk in that process.